Welcome to Doctors on Call. I'm Jenna Miller. Whether you are new in town, your insurance coverage has changed, or you're facing a health concern that calls for a specialist, chances are that you will be looking for a new doctor at some point. A family doctor is also a primary care doctor. They do their residency in a variety of medical fields and are certified through the American Board of Family Medicine to care for people of any age or gender. Whether it's a general practice, or family medicine, the physician and their staff aim to improve the health of all people. That's our topic today on Doctors on Call with our guest, family physician, Dr. Tyrell Summers.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from Gove County Medical Center in Quinter. Healing through caring. Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A Value Kansans Trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
Russell Regional Hospital, experts, neighbors, friends.
Dr. Tyrell Summers received his medical degree from the University of Kansas School of Medicine in Kansas City. He completed his residency at the University of North Dakota Center for Family Medicine in Bismarck, North Dakota. Dr. Summers is board certified through the American Board of Family Medicine and is a member of the Kansas Academy of Family Physicians, American Academy of Family Physicians, and the American Medical Association. His professional interests include chronic care management, gastroenterology, pain management, and psychiatric disorders. Dr. Summers has been affiliated with Russell Regional Hospital since 2015. Our phone lines are open at 1-800-337-4788 toll-free if you have any questions regarding family medicine on today's show. Doctors on Call brings you information which may be useful to you when you see your own physician. Thank you so much for joining us tonight, Dr. Summers. We'll go ahead and get started with some questions while we wait for those calls to come in. First of all, let's talk about what a patient should look for when deciding on a family physician.
So when looking for a family doctor, it can be very tricky, it can be very challenging. One of the things that you want to look for is you want to find somebody that can really kind of connect with you and really kind of make a strong bond with you. You want to find a doctor that you can trust and that you can share private and sensitive information for. The other thing you might want to consider is a doctor that's nearby you, especially when it comes to getting access to care and getting high quality care. The closer and the easier it is to get to a physician, the better it can be for you and for your family.
What kind of questions do you think a person should ask when they go in to make sure they're going to mesh well with their physician?
I think one thing that you really want to ask a physician when you first start seeing them is how comfortable they are with treating you. You have a plethora of different medical conditions that you're coming in with, and some of them can be a little bit advanced, some of them can be a little bit tricky to take care of. And some physicians do really, really well with those types of diagnoses, and some don't. And so just being upfront and honest and asking, are you comfortable with taking care of me, is a very important question to ask. The next thing I always enjoy is I always like when a patient asks me some private questions, some personal questions about my family, about my kids, about what brought me to Russell. All those things are really important, and it also kind of lets me connect and see from a personality aspect if a patient and I can get along.
And how important, on the flip side, is that for you to ask a patient those kind of questions?
So normally when I ask those kind of questions, first off, I'm not just asking information to be nosy. I'm actually asking it to determine social history about a patient, to find out what they work, because sometimes that can cause different kind of health concerns. Sometimes it can raise exposure concerns that we'll need to know about. The other thing too is we like to know that information just basically to get to know our patients and to be friendly with them. So that also gives us some good information.
So what happens if a patient comes to see you for the first time, or not just you in particular, but a doctor in general, and they don't maybe feel like that's the right fit? What should they do?
I think the big thing is if you don't feel like you connected well with that physician on the very first visit, I would definitely start looking for another provider. It's nothing against the doctor. It's just you kind of have a general gestalt and a click with the doctor kind of from the first time that you see him. And so if that just does not work, it's okay to say, I want to go look for another doctor. It's completely fine to give it some time too and to always come back and see the doctor again. But most of the times I find if you find a doctor that you really just connect with, that's a good thing. And if that's not there, it's probably better to just get another relationship with a different provider.
Okay. We're going to go to the phone lines now. We've got Jennifer on the line from Mankato. Hi, Jennifer. Go ahead with your question for Dr. Summers.
Hi. I was wondering, my family and I have been fighting this cough and off and on fever and just not feeling so great for several weeks now. And I just wondered, when do you go ahead and go see your physician? Or, I'm thinking they'll probably tell me it's viral, nothing they can do. When do you get to the point where, yes, you go ahead and should go in and see someone?
Thank you for your question. That is an excellent question. I have many patients who come in with kind of similar complaints and similar concerns. The big thing is a lot of viral illnesses can kind of prolong and can kind of last for a very long period of time. A specific one we've seen recently has been the human metapneumovirus, which can persist anywhere from about 3 weeks to even 4 weeks worth of symptoms that just carry on and carry on and carry on. And it's always frustrating as a patient when you go to a doctor and you see them and they just tell you it's a virus and that you got to just tough it out and it will get better. There's a couple things I can give you hints with that might help make your care get a little bit better and so that you can see a doctor at the right time. The first thing is fever signs. If you see yourself having a fever, it gets better and then it comes right back. That can sometimes be a sign that there may be a bacterial infection and that you need to be seen. The second thing is what we call a double worsening effect, which means that you got better for a short period of time and then all of a sudden it got drastically worse. If that happens, the chance of it being a viral infection is much lower. It's most likely a bacterial infection at that sign. And then of course, a period of time that just takes a long time to recover, it's never a bad idea to see a physician just to be sure and to double check there's nothing else that's going on. So I know it can be frustrating at times. It's tough when you see a doctor, you pay that copay, you're hoping to get something that will make you feel better, and all we say is, sorry, it's a virus. That's always a tough thing, even for a doctor to say to a patient.
Now, what happens when a patient comes in and they're a lot of times just looking to get an antibiotic? They're thinking that would be a quick fix, but you can't explain that, why some antibiotics are resistant to some illnesses.
Yeah, so the topic of antibiotic resistance is a very hard one to cover because for a lot of patients, when they take the antibiotics, they feel better. But naturally, the antibiotic would probably have not even be needed because their body was fighting the disease on its own. Antibiotic resistance is a very serious thing in medicine, though. As we continue to use antibiotics over and over and over again, the bacteria start to become resistant to those types of antibiotics. Even regular bacteria that we have on our skin, that we have in our gastrointestinal flora, all those can get resistance. And as it builds up resistance, it becomes harder and harder for us to treat. That's not such a big deal for healthy patients like us, Jenna, but when you get people who are immunocompromised or elderly, or even young kids that get these multi-drug resistant infections, that can cause a real big toll on their health and can end up causing them to even die because of the complications of those infections. So we try to minimize the use of antibiotics in the general population to avoid any kind of severe infections in those that can't fight the disease on their own.
Excellent information. We're going to go back to the phone lines. We've got Casey on the line from Winfield. Go ahead with your question for Dr. Summers.
Well, Dr. Summers, I've had a long-time problem with insomnia, and I've been on the medication Ambien for a few years now, and I'd like to get off it. I've been trying natural approaches, and it hasn't worked. If you could tell me something about that, please.
Absolutely. Insomnia is a very, very tricky thing to treat because it's a difficult time falling to sleep and kind of keeping yourself asleep at night. And there's two different components to that process. The medication Ambien, which you mentioned, is a good medication to help you fall asleep. The problem is that sometimes it doesn't really keep you asleep during the middle of the night. The other thing that's tricky about Ambien is it belongs to a drug class that can kind of form a little bit of a dependence and a tolerance to it with time, which means getting off of the medication can be tricky. What's the best thing to do when it comes to that is to probably sit down and talk with your prescriber specifically to talk about a regimen and a treatment to get down off of that Ambien, because it will take a little bit of a tapering dose over a period of time to get it better. Now, the second part of your question, as far as natural things that help with insomnia, that's very tough too. Melatonin is one thing that some people take. If you look at the research studies on melatonin, it doesn't really provide a massive benefit for falling asleep. By far the best and the most important things is to follow good sleep hygiene, which means that you fall asleep in the same place every single night, you keep it dark, and you stay away from any blue light about 30 minutes to an hour before you fall asleep, which means no cell phones, no TV, no nothing. Trying your best to relax and to go to sleep. For many patients, unfortunately, that just doesn't work and they have to do other treatments. There are other treatment options, though, besides Ambien and drugs like it that are non-dependent and non-tolerance forming that you could try as well. That'd be a great conversation to have with your doctor.
Excellent. Okay, back to the phone lines we go. We've got Kathy on the line from Hayes. You are live on the air. Kathy, go ahead with your question for Dr. Summers.
Yes, I have a little bit of a phobia with germs, And when I, especially in the wintertime, feel like maybe I should be getting to the doctor, I have high anxiety about picking up the germs in the doctor's office. So I'm wondering about that. How likely is it that you pick up germs from other patients that may be waiting to see the doctor?
That's a great question. It really is. There is a chance that you could easily pick up an infection from another patient that's in a hospital. Absolutely. Even in a clinic, there is a chance that you could pick up an infection. Now, that risk is exceptionally low. There are 3 things that you can do primarily to minimize that risk. The first thing is if you're around anybody that looks like they're sneezing, coughing, hacking, or just sick in general, keep your distance away from them. Try to keep yourself at least 3 feet or more away from them. That will help minimize the risk of you getting an infection. The second thing is to make sure that you wash your hands. That's by far the most important thing. You will see numerous items on the walls of a doctor's office, on a clinic, that has the foaming stuff, has a little green gel. You can use that all you want. Doctors don't mind a patient ever going up and using that to clean themselves off. That's completely fine. And then finally, the last thing is to make sure that if you are sick yourself, to keep yourself far away from other people. That will make a massive difference as well.
Now, what about the the foam or the antibiotic? Is that just as well as washing your hands with soap and water?
Actually, studies have shown that it's just as effective as using soap and water for washing. In order for soap and water to be as effective as the gel and the foaming soaps, you need to make sure that you wash your hands for at least 15 to 20 seconds. And that's tough to do for a lot of people that are on the go, whereas it's a lot quicker to use the foaming soaps, to use the gels, to rub their hands quickly and be done with it.
What are you seeing right now that's coming through the clinic that you're struggling with, I guess?
Yeah, there's a bunch of different simple things that come through. We always have the common cold, the coronavirus, the rhinovirus, that causes the sniffles, the no fun stuff that everyone has to deal with. One big thing that we've seen recently is a big rise in a stomach-like virus that's called norovirus that basically causes really bad diarrhea, really bad vomiting. It's an awful thing to have. It keeps a lot of patients at home. They really have to rehydrate afterwards. They're prone to dehydration, especially if they're elderly or young. So we were telling a lot of folks to make sure that they keep up on their fluids when they get that and try to stay as comfortable as possible.
What are some remedies a person can follow with those symptoms?
Yeah, so the biggest thing when you get like a stomach flu, a stomach infection is to really just kind of take it easy as far as bland foods are concerned, trying to not eat anything with too much spice, with too much salt, and then water by far. A lot of the stuff that brands themselves as rehydration solutions like the Gatorade and things like that, they really don't help as much because of the sugar content that's in them. Pedialyte might be okay, might be acceptable, but honestly, just plain water works the best, and that's what I would encourage most folks to do, trying to stay on top of their water intake.
Let's talk a little bit about the difference between emergency room care and urgent care, and when a person needs to decide which one they need to go to.
Yeah, it's a tricky thing to figure out. Emergency room care is definitely important and definitely a very pivotal part of a medicine within the United States. I would never ever hesitate to tell anyone that if they're in an emergent situation to seek out emergent care immediately. Now, urgent care is there most days, almost 8 to 10 hours a day, to be honest with you. And urgent care is nice because when you don't have anything that fits emergent criteria, they can get you taken care of. For most common things that occur in day-to-day life, urgent care is more than acceptable. It's more than okay for you to go to. Emergent care should really be used for just that. If you're having something in which you need help immediately at that second, emergency room care should be used. Otherwise, if there's something that can wait 4, 5, 6 hours, urgent care is probably safe for you to wait for and to go to.
Excellent. Now, you had talked earlier about colds and sniffles and coughs. When does a person have those symptoms? Those and the allergy symptoms are very similar. So how do they know which one is which?
It's tough to tell the difference between the two of them. Sometimes the color of kind of the nasal discharge can give a hint, but really, without a physical examination, you can't really tell the massive difference between the two of them. A physician who's well trained can easily look into a person's nose, can look into the back of their throat, into their ears, and tell the difference between a common cold and seasonal allergies or something very similar to that. If you have any hesitation, you can always contact a provider, have them take a look at you and see. The other thing that's an option is you can always try over-the-counter remedies for seasonal allergies, such as like Nasacort, Flonase, the nasal sprays, or even like Claritin, Singulair, and see if that gets better over the next like 5 to 7 days. Normally, if it's an allergic process, it will, and then you're all better. If it's a virus, it should be gone by that point too, which makes it a little bit tricky. But most of the time, if you just try some things that are remedies that you can find over the counter, they will help.
Right, and now what's the difference between that and a sinus infection?
Yeah, so a sinus infection, I mentioned earlier this process that was called double worsening, which basically occurs in most of the bacterial infections that exist. So what happens in a sinus infection is the person might get better at a period of time, and then all of a sudden gets a high fever, sinus pressure, sinus tenderness, kind of in these areas here, and then they start just having increasing discharge that's thick and kind of purulent. When that happens, that can mean that you have a sinus infection, that you might need antibiotics to get better.
Excellent. Okay, we're going to go back to the phone lines. We've got Amanda from Hayes on the line. Go ahead with your question, Amanda. You are live on the air.
Hello, Dr. Summers. Hi, Amanda. I had a question. I had heard that ear tube referrals were on the downhill slide. My daughter is almost 15 months old, and she has had, I believe, 3 ear infections within about a 3-month period. And so I was just wondering if that is true, and what, from a doctor's standpoint, is the criteria for when you do decide to do a ear tube referral?
Thank you for your question. Ear tube placement has gone down in the last 10 years as compared to previously, and that's because we found that the risks that undergo surgery sometimes do outweigh the benefits of having ear tubes. With that being said, they are very important in some kids and getting them healthy and getting them to where they need to be. So there are a couple criteria that we look for. The first thing is inner ear infections or otitis media. If a patient has those at least 3 episodes in a 12-month period, they might meet criteria for ear tubes. The second thing is that they have problems with speech development. If a patient just continues to have difficulty in staying behind in their speech, it might be related to chronic fluid that they have in the back of their ear, and that they might need to see a specialist for ear tube placement. That's been beneficial in a lot of kids if they do have that problem. If you ever have concerns or worries, though, don't hesitate to come in to be looked at, to be evaluated, even to see an ENT provider, which is a specialist that places those tubes.
Is there any preventatives for ear infection, especially for the littler children?
So by far the biggest prevention that can be done is just making sure to avoid kind of general infection causes to begin with. So again, the hand washing techniques that we talked about, making sure that you're keeping your distance from those that are sick, and when you're sick yourself, to stay away from other people. That by far will help minimize the chance of getting an ear infection. Otherwise, there's not too much. Like they used to think that when you cleared your nose and you had kids blowing their nose all the time, that would reduce their chance for an ear infection. And studies have shown that's really not honestly the case.
Well, speaking of the younger demographic, how does a person decide whether to use a pediatrician or to see your family physician?
That's a good question too. A pediatrician is a doctor that specializes in taking care of kids. They can be kids between about birth all the way up to 18 years of age. And so it makes it very, very tricky to know which is better. A family doctor is trained in really seeing anybody of any age. So what I typically tell most patients is whoever you have access to will provide you good care. It's as simple as that. A family doctor will take care of you past the time that you get 18. And so if it's somewhere where you plan on staying and plan on establishing, it's probably best to see a family doctor because they can provide for that patient's care throughout their entire lifetime. With that being said, I have plenty of great pediatric colleagues that do a wonderful job taking care of children, and I would never ever tell you not to see a good pediatrician.
So once you start a family, it isn't necessary always to see a pediatrician. You can go to a family physician.
Absolutely, yeah. A pediatrician is good, but you can also see a family physician for most general things that happen with children. If your child has like a really severe problem or a severe diagnosis, it might warrant to get a pediatrician, but by then you'll probably have pediatric specialists involved as well, and you'll know that you'll need a pediatrician for routine care.
Excellent. Let's jump to the topic of second opinions, and how do you know when a second opinion might be a good option?
Yeah, so a second opinion is always a tricky thing to determine, especially as a doctor. It's hard to tell when that time is right to get somebody else to kind of weigh in on it. One of the things I tell my patients all the time, and I think most doctors should kind of keep this in the back of their mind and in the back of their heart, is that it's never wrong to get extra help and to get extra information from somebody else. As a doctor, I studied for 12 years. When it comes to a medical school, undergraduate, and then training I did afterwards, I have a lot of intelligence when it comes to what's going on with a human body. With that being said, I don't know it all. There are some times that there'll be diagnoses that are really tricky and tough for me to get. And I need one of my colleagues who specialized and spent extra time, which could be anywhere between 3 years to 5 years more than I did on specific topics. There are some cardiologists that perform routine cardiovascular practices and procedures that have years and years and years of experience on top of mine. Their expertise in the heart is far beyond what I could ever give. And so if I don't know what to do, it's never a bad idea to go to somebody else and to do that. If you have a doctor that you're unsure is willing to make that second opinion, ask. Just straight up be blunt with them and say, hey, I'd like somebody else to weigh in on this. They might get offended, yeah, sure, but truth be told is it's better for you to try to get the extra care that you want and to get somebody else to weigh in on what your problems is. And hopefully your doctor won't be offended by it.
Do you feel it's necessary to let that doctor know I may be looking out for a second opinion?
I don't think that's a wrong idea at all, to basically just talk to him and say, hey, I'm kind of thinking about a secondary opinion, so that they can start in the back of their mind thinking of who would be good to get them to.
And I know we're in cold and flu season right now. Maybe that never really goes away, but when could it turn into pneumonia? Or what? Let's talk about pneumonia and the different types of pneumonia there are.
Yeah, so there's a group and clustering of different types of pneumonia. By far the most common one is what's called the community-acquired pneumonia, which basically just happens from something that you get from the rest of society around you. It doesn't happen very frequently, actually. A lot of people who get ill don't end up getting pneumonia. It's very, very rare of a complication. But when it does happen, you kind of need help, and you need help quickly. And so, again, one of the big signs and symptoms that we see is this double worsening effect that I've talked about. People will start to get better, and then all of a sudden, out of the blue, they get drastically worse. And that can happen along with high fevers, a productive cough, and then they start to get really, really, really sick. If those things happen, a person needs to seek emergent care as soon as possible.
Now, one of the callers had asked about, or said she was a little bit of a germaphobe. What about if you're hospitalized? You hear, often of the staph infections or infections how can a patient protect themselves?
So the biggest thing is the hospital is already taking precaution measures when it comes to taking care of patients. And so if a patient has staph or if a patient has something that's communicable between patients, we have precautions already put in place. We put on gowns, we put on masks, we put on gloves to make sure that we're not spreading the infection between patients. The other thing is don't go into other patients' room unless you absolutely need to. If you're visiting a loved one in the hospital, that's great, that's fine. Make sure that you're not going back and forth between multiple rooms and multiple things. As doctor, between every single patient room, I'm washing my hands on multiple occasions to make sure that I'm not spreading disease. As a patient, I would just say avoid the hospital if you can. Of course, I never want to tell you not to go see your loved one when they're sick. That's really important to help them in the healing process. But if you've seen them and you've given that admiration, maybe give them some time to heal and to recover.
Oh, is there any truth behind, you hear a lot when people get sick, drink your fluids, drink water, water, water. How true is that?
It's very true. Hydration is extremely important in the recovery process of a person who's acutely ill. One of the big things that can happen when you're sick is your white blood cells need to go and fight that infection. And without the ability to get blood flow to and through that area, that can minimize and hamper that. The other thing is the kidney filters a lot of kind of infectious processes through them and also a lot of toxins and chemicals through them. And it can minimize when you're sick. By drinking, that helps promote kidney function even better and makes it so that your kidneys don't have any problems with that.
Along those lines, how important is it to eat well?
Yeah, so nutrition is extremely important. Having the right amounts of nutrients and vitamins makes a huge difference in the health of a patient overall, especially a patient that is sick or a patient that is ill. Vitamin C, though it hasn't been shown to benefit individuals who are acutely ill, is definitely important for just general overall health. And so I encourage my patients all the time to make sure that they're eating a nice balanced diet to make sure that they reduce their risk of illness.
We have just a couple minutes left, but I'd like to talk a little bit about pain, chronic pain and otherwise, and how you treat that because we know there's a lot of people that are in physical, emotional pain as well.
Yeah, so chronic pain is not just a physical symptom that happens to individuals. Chronic pain is a whole kind of archetype of different types of pain syndromes that can happen in a patient. The big important thing to know is that chronic pain is something that lasts longer than 90 days. For most people, when they get some pain, it just kind of occurs and then it goes away. But for people who are in chronic pain, it's daily pain, in and out every single day. It's a tough thing for them to deal with.
All right, now how effective, if you're in chronic pain, how effective is over-the-counter pain meds, Tylenol, ibuprofen, how effective is that?
So Tylenol and ibuprofen definitely have their place in helping with the management of pain, but in people who have chronic pain, they are not nearly as sensitive to those medications as other medications. By far the biggest thing is to know if you're in chronic daily pain, that medications that we use for pain can be used to help with the discomfort that you're in. The biggest problem is that as you use those medications, they can sometimes cause side effects and sometimes cause problems. You can also form a tolerance to them, which can be a really bad thing as well.
Okay. We're just in the final seconds of our show. You might reiterate to our watchers, our viewers, what they need to do to stay healthy this year.
So the biggest thing is to make sure that you're always washing your hands, you're always keeping yourself clean, make sure that you're avoiding exposures to other people that are sick, and then when you're sick, keeping your distance from everybody else.
Excellent. Well, our thanks goes out to Dr. Tyrell Summers from Russell Regional Hospital for being our guest on our first show of the year. Thank you so much. On our next Doctors on Call, we'll be discussing pet health with Dr. Steve Mosier. You can email questions for our next program. That address is doctors@shptv.org. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from Gove County Medical Center in Quinter, healing through caring. Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A value Kansans trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
Russell Regional Hospital, experts, neighbors, friends.